Hello, my name is Tyler Erickson. My family has been afflicted with cardiomyopathy. The picture above is my father's side of the family. My grandmother, my uncle Jerry in the middle, my uncle Tom next to him, and then my father on the far right, all have been diagnosed with cardiomyopathy. My grandmother and my two uncles in the middle have had heart transplants. So cardiomyopathy has been an important part of my life and continues to be to this day. What I'm about to do is explain what cardiomyopathy is, the types of cardiomyopathy that exist, the signs and symptoms, diagnosis, and treatment of this disease. Cardiomyopathy is a disease where the heart becomes weaker and does not pump efficiently, and the blood cannot get throughout the body, which causes many different problems for people, and people just respond differently to those problems. There are many causes of cardiomyopathy. Some are not very specifically known, but there are many reasons why people get cardiomyopathy. They can include high blood pressure over an extended period of time. They can come from alcohol abuse. They can come from drug abuse. Women with pregnancies can develop cardiomyopathy. It can be inherited like it is in my family. And there are many other causes, including radiation and other potential reasons why people develop cardiomyopathy. One cause or one type of cardiomyopathy is called hypertrophic. In this case, a normal heart wall, as you can see in the picture, is consistent throughout the heart. The size and the thickness is all the same. What happens in a hypertrophic heart is the walls start to thicken, and it becomes thicker, which decreases the chamber sizes, and less blood flow goes into the heart, and thus you cannot get as much blood pumping through the heart as a normal heart would be. So the heart becomes smaller and smaller, and again, that lower volume of blood is not pumped throughout the body. So that causes problems, and that's one of the types of cardiomyopathy. The second type of cardiomyopathy is something called restrictive. In this case, the walls of the heart become very stiff or less elastic, and what happens is you don't get that heart contracting and get a good pump of blood out into the system. So you don't pump again as much blood throughout the body. The third type of cardiomyopathy is called dilated. This is the most common. And what happens is it starts out in the left ventricle. The left ventricle becomes weaker, and what happens is the heart tries to overcompensate, so it becomes bigger and the whole chamber becomes bigger. Well, what happens then is the heart muscle itself becomes weaker, and again, that cause of not getting enough blood pumped throughout the rest of the body happens because the heart is weaker. Early on, the signs and symptoms of cardiomyopathy are basically invisible. There are no overbearing signs or symptoms that a person with cardiomyopathy may have early on. You can live a very normal life and still have cardiomyopathy in early stages. But as the disease gets worse, more and more signs will happen. One is a shortness of breath that can develop. The sensation of somebody sitting on your chest or not getting a full breath is some of the words, or is how this feeling is described, and you just can't get a full breath into your lungs, and it causes very much discomfort. Additionally, because your heart is not pumping blood throughout, or as much blood as it should, you'll get swelling in your lower legs or in your stomach. And what that causes is you'll get swelling, and it'll start to get puffy, and you just won't feel, or they won't look normal, and they'll start to thicken. Additionally, you'll get, as your heart becomes weaker, you'll experience fatigue, tiredness, and not a lot of energy. And finally, you can develop what they call a dry cough. And what happens is your lungs get a dry sensation in your throat, and you will develop a slight cough from really no reason. How do you determine if you have cardiomyopathy? Well, all of that basically comes into a lot of different tests that can be done. They can look at blood tests to see your blood, and if there are any indicators of enzymes and things in your blood that might be elevated. Um, that will give an indication that you may have um, cardiomyopathy. They can do electrocardiograms to check the rhythm of your heart. Oftentimes, what happens is as the heart becomes weaker, you can develop arrhythmias of the heart, which are irregular heartbeats. And electrocardiograms and stress tests can develop or are developed to show those type of symptoms. Um, Cardiac catheterization is another thing that they can do, along with coronary angiograms, and basically those are shooting dye into your arteries and to look at your heart to see the size and to check the wall thickness of the heart to see if it has developed into cardiomyopathy. Additionally, genetic testing and heart biopsies are done, again, just to verify the extent, or if you have a tendency with genetic testing, if you have a tendency to be inherited or passed down like it is in my family. The treatments, the treatments for cardiomyopathy depend on the stage. As this is a disease that progressively gets worse, there are different things and different treatments as the disease progresses. The first thing to look at is trying to prevent the disease from getting worse, and many times that involves a lifestyle change. The two biggest things are eating properly and exercise. You want to look to a diet that is low in sodium, low fat, low sugar, and trying to eat healthy to lose excess weight, because your heart works harder if you are overweight, and losing those extra pounds will help you and your heart work better and more efficiently, so it doesn't have to pump blood to as big a mass as it was. Exercise is good. Exercise strengthens your heart and your heart tissue. So the advice is you probably won't be able to run a marathon, but you do want to do as much as you can and to push yourself to make sure that your heart stays strong. As the disease progresses, and if you develop symptoms where fluid collects in your legs or in your stomach, diuretics and other medicines can be given to help you get rid of that fluid. Again, it gets fluid away from your heart. Your heart can pump better and more efficiently. So excess fluid is one thing that you want to make sure that you take those diuretics to get rid of that excess fluid. Additionally, blood thinners such as aspirin or Coumadin are given to try to thin the blood to make it run through your arteries and veins more efficiently, so that it is easier for the heart to pump. And additionally, people with cardiomyopathy tend to have a higher blood pressure, so lowering that blood pressure is a good thing, and you can do that with beta blockers, and ACE inhibitors. As the disease progresses even further, you may need surgeries. As discussed in the hypertrophic type of cardiomyopathy, there is a surgery called a septal mycotomy that reduces the wall thickness of the heart. This allows you to open up that chamber and increase the blood flow in that chamber. That has been successful. Also, as the arrhythmias, to help take care of those, mechanical devices can be implemented. Pacemakers, defibrillators are implanted, and those are things that help make your heart beat on a regular basis. And also, if it goes into tachycardia or fibrillation, a defibrillator will shock that heart into a sinus rhythm and get back into a normal beat. Finally, as in my family, we have 3 heart transplants. Heart transplants are the final surgery, but it is a successful surgery, and you can lead a very normal life after that, a successful transplant, but they are not very common to happen. In conclusion, it is difficult to get an early diagnosis of cardiomyopathy. There are very few symptoms, and once you find out with tests that you have cardiomyopathy, the best thing to do is to have a lifestyle that prevents the disease from getting progressively worse. There are many things that you can do: healthy eating, exercise, taking the medications to help improve your life and to improve your health will also eventually keep you alive longer. Finally, as treatments with the medications, lifestyle changes, those things, and surgeries that have been successful in causing people to gain a healthy life through defibrillators or transplants. They are extreme measures for treating cardiomyopathy, but they have been successful. Cardiomyopathy is a dangerous disease. The biggest thing is to not let it progress to a situation where a heart transplant is needed. My father was diagnosed with cardiomyopathy after my grandmother's diagnosis, and he is doing what he can to change his lifestyle to make a healthier lifestyle, and so that he doesn't need to progress with any surgeries. To this point, he's lived with it for over 20 years, and he hasn't needed to have any surgeries. With this, I conclude my story on cardiomyopathy.